Good morning and welcome to Chatham-Kent. I'm Dr. April Rejek, General Manager, Health and Family Services, and we're pleased to be with you today and share with you the story behind the Chatham-Kent Community Leaders Cabinet. This conference, we've already heard, is about leadership and innovation, and I truly believe that you will hear that in all of the speakers here today. They have modeled visionary leadership by being willing to work together through a tri-sector integration approach and agree that the vision of enhancing quality of life for others is something that, while it may seem daunting, we should all strive for. The format of our time together will include an overview of the cabinet, so I'm going to provide a bit of an overview of how we got to where we are today. And then I'm going to turn it over to the panel members who will each share a different perspective of what they have done and how we have accomplished the Chatham-Kent Community Leaders Cabinet. And we'll just, there we go. So we have worked on creating a healthy community in Chatham-Kent for many, many years. At the beginning, our focus was really on getting people to change their behaviors and providing programs. And we've all been part of that. Everyone in this room has done that for years. As time passed, we really learned that the way we create our communities has a direct impact on our health, and we needed to look at new methods and approaches. So we thought back, way back to 2010, when the World Health Organization published the Adelaide Statement on Health and All Policies, noting that solutions to our complex and urgent problems require collaborative efforts across many sectors and all levels, including government agencies, businesses, and community-based organizations. We knew that the way that we had been working was not changing the rates on some of our key issues that we were dealing with here in Chatham-Kent. And this statement really confirmed the importance of working from a tri-sector integration approach and engaging our leaders. Recognizing that changing the health of a community is a complex challenge requiring long-term commitment and broad sector coordination. I asked to meet with Mayor Randy Hope, and he accepted the challenge of really championing health and quality of life for the residents of Chatham-Kent. And he agreed to bring a group of leaders together to really work from the social voluntary sector, the business and government sectors, to really discuss on how working together could improve residents' lives here in Chatham-Kent. And to celebrate World Health Day, the leaders signed a formal resolution to work together. And we're going to show you the video of that resolution, only because there's all kinds of kids and it's really cool.
As leaders in our communities, we were all dealing with strategic plans, we were all talking about the community, but one thing we weren't doing is integrating ourselves amongst each other. Through the cabinet as being established today is going to give us is the working mode, how we begin this process.
The health statistics in Chatham-Kent are certainly an issue for us in public health. We have a wonderful agricultural base. We grow a vast amount of fruits and vegetables here in Chatham-Kent, and we are the lowest consumers of fruits and vegetables in the entire province. We have an obesity rate that is above the provincial average. We have children living in poverty right here in Chatham-Kent. And for the first time ever in history, the children that are born this year have a really, really good chance of having poorer health and lower life expectancy than their parents do.
I was invited onto the Mayor's Community Cabinet, and when you're talking about the future, you're talking about the kids. We were really excited to be asked to be on board, and when you talk about the future of the community health, I think it's terrific that we were given an opportunity to include the children. And the children did the artwork. They were asked to illuminate questions about what you would do if you were mayor for the day. How can you make a community better? What I was really struck by, frankly, about the first 8 or 10 response were exactly what an adult would say. They want to reduce crime, they want to make our community safer, and make our schools and community clean. So I thought the kids did a great job.
Their pictures are worth 1,000 words. It talks about the community they want. You reflecting on the Children's Charter of Rights, which was presented to our council. I think it's so important that they're our future. We talk about retention, we talk about keeping our young people here. Maybe if we start listening a little bit more about what their ideas are and their visions are, what they want to be when they grow up, I think is important. That sets the path and where we want to build a stronger community.
And I think that needs all of us to stand up and take notice and to take action. So bringing a group of leaders together to all focus on quality of life improves that quality of life within our community, where we will really be paving that road to make this a better place to live, to learn, to work, and to play for all of our children that are Chatham-Kent's next generation.
And when you want to work on that next generation, they were so excited to sign that charter, just like all the leaders were doing. So it was a wonderful day. The mission of the Cabinet is working together to build a community where quality of life is planned, developed, and championed. The vision to be a better quality of life for everyone in Chatham-Kent. And when the leaders signed off on that resolution, they signed off really thinking and abiding by the guiding principles that came out of that. Individuals are only as healthy as the community they live in. All Chatham-Kent residents have the right to the healthiest life possible. Quality of life is dependent on strong leadership in government, business, and the social voluntary sector. No person or group working in isolation can solve complex problems. And involving individuals, groups, and communities as part of the solution is critical. So if you think about those guiding principles, we have looked at the social determinants of health, health equity, cross-sectoral collaboration, collective impact, and community engagement. And you're going to hear more and more about this with our panel and throughout your 2.5 days here. So what would the Cabinet focus on? They really decided right at the beginning that there would be 3 key focus areas: healthy living, education and learning, and the economy. There were also 3 overarching activities were determined to be important: CK Counts, which is more or less our scorecard in our metrics; CK Recognize, where we look at the great work that's already happening in Chatham-Kent; and CK Engage, where we engage others to align their initiatives in order to have mutually reinforcing activities. Various items have been produced, and we've placed a bunch of things on the table at the side, over at the wall that way. So feel free to pick up anything that you'd like to take back with you. Lots of things have been very, very well received. CK Counts is actually being used by Municipal Council as part of their quality of life reporting system for community progress. To help move the vision into action, the Cabinet worked with a number of multiple groups as part of CK Engage, our Best Start Network, our Healthy Communities Partnership, our Workforce Planning Board, and our Prosperity Roundtable. And Valerie, when she speaks, will talk about the role and benefits of being a collaborator, and she'll do that for us in a few minutes. One of the first successes that we had with the Cabinet was CK Tobacco Free Initiative, where now Chatham-Kent is the leading edge bylaw that includes no smoking on all of our parks, our playgrounds, our beaches, our sporting fields, special events, and I could go on and on and on. And the Cabinet really, really came together to look at how could we make system change happen. So the Cabinet issued a call to action, really stating to everyone in Chatham-Kent that children are still being exposed to secondhand smoke, youth are experimenting with tobacco products, loved ones are getting sick, and there's a financial burden to workplaces and our healthcare system. And we asked everyone to pledge to make CK tobacco free. Our school boards actually banned e-cigarettes, one of the first school boards in the province to do so. And this picture again, members of the Cabinet with kids being smoke-free. The Cabinet did create a strategy document, and I could spend an entire morning talking about that document. I think what's key from that is that Council and Cabinet have really come together, and there's one statement in both documents that really resonates with me, and I hope it resonates with everyone in the room, that no single organization, however innovative or influential, can accomplish large-scale social change. it takes the entire community. And this is the cultural shift that's occurring in Chatham-Kent. So before I get to the panel, I just want to go quickly through a couple of items that the Cabinet supports and endorses. We have 2 recognition programs. One is called Feature Act. This is a partnership with our Chamber of Commerce's to celebrate actions taken to increase quality of life and to say thanks for building a healthier Chatham-Kent. One is our Workplace Wellness Recognition Program, and that recognizes businesses and organizations that create cultures to make it easy for their workforce to be well. And last, I don't need to spend a lot of time because OMSSA is supporting CK Kids Count, and this is our opportunity to really say thanks to meeting and conference presenters by helping children to be active and to learn. And that's a great initiative that we'd be more than happy to give you lots and lots more information on. The other thing that we are in the process of doing is creating the Erie-St. Clair Regional Data Consortium, and that is really there to share data between service providers, to purchase data collectively, but most importantly, to work together to identify strategic opportunities for integration. Well, there is so much more that I could talk about. And as you can see, after a couple of years of the Cabinet in place, we could go on and on and on all day long. But I'm going to let the panel speak, so I will begin by briefly introducing each panel member to you. Their full bios are in the conference app, so feel free to take a look at that. Gary Switzer is the Chief Executive Officer of the Erie-St. Clair Local Health Integration Network, and he is also the co-chair of the Community Leaders Cabinet. Steve Baker is President of Union Gas, Spectra Energy's Ontario-based natural gas storage transmission and distribution company, whose head office is here in Chatham. Steve is a member on the Cabinet representing the business sector. Valerie Colasani, who many of you in this room know, is Director of Employment and Social Services with the Municipality of Chatham-Kent, and she is the collaborator lead and liaison to the Cabinet for the Chatham-Kent Workforce Planning Board and the Prosperity Roundtable. And Karen Loney is the coordinator of the Community Leaders Cabinet. She's a health educator with Chatham-Kent Public Health. She actually works out of the mayor and CAO's office and has quite an interesting role to balance those two things. And she really is the legs behind making sure that the Cabinet happens the way it should happen. So Gary, I'm going to begin with you. So the theme of the conference is Leadership in Human Services, Cultivating Innovation, Strengthening Communities. I know you're passionate about this in your organization. So why is being a member of the Cabinet important to you?
Thank you. First of all, how many people in the room know what a LIN is? Raise your hand. All right. Good. So we're Erie St. Clair. This is our LIN represents the 3 counties, and I refer to it as the gateway to Ontario, where everything good starts. And you're right in the middle of it here in Chatham, as Randy told you. You've heard April talk about the need for system change, that not one organization can make that change. And as a CEO, as you move through your career, you'll find yourself moving further and further away from the clients that you serve or the patients or your customers if it's the private sector. And this gives you an opportunity as a leader to become involved for that system change that's required. We cannot do it on our own. You know, in healthcare in this region, in our LIN is responsible for $1.2 billion of funding that we spend here. So I thought, what a great opportunity to get to a table with business leaders that represent the workforce, that represent the residents, that all the voters of the area, to start talking about what's important for healthcare, what's important for business, and what's important for education. As a LIN, we're really moving the envelope on innovation. We have a joint venture with Ivy out of Western Ontario. And we bring groups together, and these just aren't agencies that we fund. We've had EMS there, we've had public health there, we've had education there. And they all come, tuition paid free for us, and they learn how to fail. When was the last time a public sector person said, let's get out there and learn how to fail? Because in the public sector, we become very risk aversive. I need people that are out there willing to take on new chances, new risks, to develop new programs across sectors to improve the quality of life for people, not just health, but the quality of life. we're leveraging that even further by opening up our offices to secondment. We want to bring in other people to learn. We just can't learn. We have a small office of 30 people. They're pretty bright people, but they're not bright enough to solve the problems that we have. So we're really fostering the need for bringing people in from other sectors as a secondment, their careers protected back at their home base, just to make sure that it happens. So needing to break the silos, needing to be a leader to step up and be part of it. I can't sit on the sidelines anymore. And I thought it was a great opportunity to get down and dirty, close to the people that work and live and earn a living in their communities.
Thanks, Gary. So, Steve, I'm going to turn my next question over to you. You've been an active member of the Cabinet since its inception. The Cabinet's purpose is to work from a tri-sector integration approach and to bring the voluntary social sector with the government sector and the business sector together to increase quality of life for everyone in our community. Can you tell us why it's important to represent the business sector on the Cabinet and to work on enhancing quality of life?
Thanks, April. Let me just say it's good morning to everybody. It's great to be here. You saw a lot of the picture of the agricultural community that we have here. I actually grew up in Chatham. I've been a long-time resident here. I grew up on a farm just outside of Chatham, so I've been in this community a long period of time. It's a great community. I'm never sure that I could have predicted that I would have been living and working in Chatham earlier on in my career, but I can tell you it's been a fantastic journey for me, and it's great to be living and working in the community that I grew up in. I think from a Union Gas perspective, I think first of all, we've got about 1,300 employees that live and work in this community. So we're definitely one of the biggest employers in Chatham-Kent. And what we do as Union Gas, a big part of what we do as a gas distribution utility, we're active in serving over 400 communities across the province. And what we try to be is the partner of choice in the communities that we live and work and operate in. And when I think about what we try to do as a company, that was really very well aligned with the purpose of the Cabinet, which is how to be that partner of choice, how to make our communities better, how to make them stronger. You know, Randy and April touched on the quality of life, you know, the components that we've established and talked about as a Cabinet in terms of having meaningful employment, making sure that we do what we can to have a healthy community. And how do we connect everybody in the community? And that's really what drew me to the Cabinet in terms of, you know, how do we bring all the various components of the community together in terms of collaborate, know what each other's doing, and use our resources and leverage them to the best way that we can. And that the Cabinet certainly allows us to work with others. I've learned a great deal sitting on the Cabinet just in terms of, you know, you live and you work in a community, but I think the Cabinet's really showed me just the amount of things that are going on in a community, the needs that are out there, the initiatives that are out there. And again, my mind's always going to, again, how can we use our resources in the most effective way to deliver the greatest amount of good in the community? And as I said, personally for me, it's really raised the awareness just how much need is out there, how many programs, how many initiatives are out there. And I think what I try to do as a leader on the Cabinet is to bring that information and those messages back to our employee group to make sure that I'm sharing, you know, what is going on in the community. How can our employees get involved where we see need, where we see opportunity? Again, we've got 1,300 employees. They're very active in the community, and I think it's just a great way for me to bring back messages to the employees. And again, work closely with all of the leaders that are on the Cabinet. They're all leaders in this community. They do a lot of great work, and for me, I learn a lot from them in terms of what's going on and how I can, as a leader in the community, bring that greater vision and power to the community. So that's really why it's important to me, and it's been a great couple of years.
Thanks, Steve. I have a question for Valerie. Valerie, what do you see as both the importance and benefits of being a collaborator and working alongside the leaders of our community?
Thanks, April. I remember when Karen called and asked me if I would attend a meeting to be a collaborator with the Cabinet, and my initial response was, wow, do I really need more work? but then quickly thinking how this could help advance the goals of both the Prosperity Roundtable and the Workforce Planning Board. When I think about the Prosperity Roundtable's vision of no person living in Chatham-Kent in poverty, and how the Workforce Planning Board is about cultivating tomorrow's workforce today, both of the groups directly support the Cabinet's vision of a better quality of life for everyone in Chatham-Kent. So it made sense for me to join the Cabinet. And this is why it's critically important that we work alongside the leaders with the Cabinet. First, we have a shared commitment of wanting to help people in Chatham-Kent have the best quality of life. And secondly, we want to ensure that we are aligning and reinforcing our activities versus duplicating them. That's really important. Some other reasons why it's important that our groups work alongside the leaders is we can't really do it alone. And you heard Mayor Hope make reference to some of the challenges that we're all facing. So it's true for us here, and why the Prosperity Roundtable was created and the Workforce Planning Board was created as well. In Chatham-Kent, we don't have a local training board like most communities, so it was really important that we started our own. We have people living in poverty who need advocates to help make systems change, and that's what the Cabinet's able to do. Sitting around the table with the leaders allows me to be the voice of those living in poverty, to share their experiences and their needs. It allows me the opportunities to tell the stories of the families who are living in poverty, who are on social assistance, and because of the lack of job skills and the need for retraining programs. It offers me the opportunity to explain why we need the bus system to run later in the evening, for people who work shift work and they don't have access to transportation. It allows me to explain why, as a community, we had to spend $60,000 this year on beds for people that have no beds to sleep in Chatham-Kent. But it's not just to share the challenges. We also want to create some solutions and engage non-traditional sectors like union gas in these solutions. So as I sit at the table, I begin to understand the agendas and the imperative issues of the other sectors sitting at the table, and I can bring that information back to the groups I work with. The Cabinet has allowed us to have a regular platform for dialogue with all sectors, and this certainly was lacking in the past. We really were only dialoguing with social services. We weren't branching out to private sector. So through the dialogue, we can learn what the leaders value and determine where their interests intersect with our goals and help to align priorities in Chatham-Kent. I'm going to give you an example, a really small example of how the Cabinet works here for us. One of the things that's really important, and we can all agree, in order to have a quality of life, we have to have sufficient income. To have a sufficient income, a person needs to have employment that provides at least a living wage. So we know there's a direct correlation between an income level and the education level. And here in Chatham-Kent, only 51% of individuals aged 25 to 65 have a post-secondary certificate, diploma, or degree. And that's compared to the Ontario average of 64.8%. So our education levels are much lower here than across the province. And if you truly want to enhance quality of life, we need to help people access post-secondary education. But how do you change the mindset in a community where people don't go to post-secondary education, people who are living in poverty, and they haven't been exposed to that, and they don't think they'll ever be able to go because they don't have the funds? This is where I see the Cabinet coming into play. So learning from some of the past OMSSA sessions I attended, we brought forward the Canada Learning Bond Program to see to the Cabinet and talk to them about it, just for some general information. The leaders in the Cabinet instantly recognized the value of the program and began to brainstorm ways on how we could get the information out to all of the community. So knowing the group was behind the initiative, we hired a summer student. This past Cabinet meeting in May, we were pleased to introduce our Canada Learning Bond Summer Coordinating, who is meeting with each leader to help embed promotion into their systems. So for each leader, there will be a different focus and discussion. For example, and I'll just go through my panel colleagues, for Gary, many of the people who are eligible for the Canada Learning Bond are the same people who are high users of the emergency room. They're repeat users for the emergency room. So when we were talking with them about the Canada Learning Bond, many other items came up, and particularly healthcare. So we're going to meet with them again in the future and see how we can potentially share some of our data and see how we can look to cross-promote our various programs and help not only increase education levels but reduce emergency room visits. So that was a great synergy. For Steve at Union Gas, he often needs to hire engineers, welders, and many other professional staff, and recruitment can be a real problem in a small rural community. It's really difficult to find people to come back to Chatham-Kent, but they often will come back if they're from here, if they were born and raised here and they have families here. So if we have more of our youth getting university degrees, we'll be able to provide a much larger recruitment pool in the future, which will allow Union Gas's head office to stay here in Chatham-Kent, which is really important to us. So as you can see, there's a real common role there. For Karen, within the municipal structure, there's a huge communication channel for disseminating information. She can get information both internally to all of our staff, many of whom might not have RESPs and might qualify for the Canada Learning Bond, so we can start talking about it that way, and also externally to the general public through her channels. So again, a great liaise for us. Will this make a difference today or tomorrow or next year? No, it's long-term work. It's very much a turn the curve exercise, but if every single member of the cabinet is talking about the Canada Learning Bond and is using it in the various ways across their organization, we might be able to turn that curve, and we might be able to start to inch up the levels of education here in Chatham-Kent, which is something we've been wanting to do for a long time. This is really about a dream. It's that every child in Chatham-Kent who wants to go can go to post-secondary education. It's about no person living in poverty in Chatham-Kent, that every person having the opportunity to have the skills to have good employment and to make a living wage. So it's about helping people to save for their future. We know that children who have an RESP are more likely to continue with post-secondary education. There's all kinds of data confirming that. You've all seen that data. We know that once an RESP has been opened, families continue to put funds into it, and they're much more likely. I believe the statistic was almost 80% if families have an RESP, the children are more likely to go to school. So I'm not going to talk anymore about the Canada Learning Bond because I know you're all aware of it, but we're really excited, and this shows a very small initiative, but how it can grow and how it can really make a difference in the community. So this is a direct benefit of us being connected to the cabinet. There's lots of other benefits of being involved in the cabinet, like sending letters of endorsement to the ministry for our workforce planning board, other informal connections, but I'm going to stop here, and I'd be glad to take questions later.
Thanks, Valerie. Great examples of how the cabinet is working. I'm going to ask Karen. Karen is our coordinator for the Leaders Cabinet. She has a unique opportunity to work with leaders across sectors, across organizations, works with the mayor in his office and the CAO. So Karen, can you share with us what it is like and what some of your core functions are?
I'm looking over at Randy, and I just kind of picture he's thinking in his head, I wonder what she'll say. All good, Randy. Anyways, thanks, April. So when I think of the work I do with the cabinet, you know, I could share with you a lot of the administrative type of work, but that kind of just be boring for you. So what I'm going to do is I'm going to group the work I do into several different themes that I feel are important and hopefully helpful that if you consider looking at this type of work in your community. I do remember when Mayor Hope agreed to champion the cabinet. One thing he said in that very first meeting was, if we were going to do this, we needed to acknowledge that it needed human resource support. And this really is something that is critical for success. I remember sitting in that meeting, I was working in the Healthy Communities portfolio and thinking, well, that would be a really complicated job, but really quite interesting as well. Well, I was soon able to find out that it actually is both. It's complicated, but it's fascinating at the same time. So I'll say having the ability to have full support to both access to the mayor and the CAO has been significant in helping to move from talk to action. And it is essential to have that dedicated support. So I really do give credit both to April for her vision and seeing that vision for the integration between the health unit and the mayor and CAO office, and the continued ongoing support of our current director of Teresa. So thank you. So the cabinet really works on the model of collective impact, which is, if you don't know too much about it, it really has 5 key elements. I'm going to briefly review each of them in light of my core functions. So the first is to have that backbone support. So when I moved into this position, we used it as an opportunity to expand my role so I could also focus on integrating health on the corporate agenda. So this has allowed me to work on things like community grants, our strategic plan, and also our official plan review. Being in this location has allowed me to seize new opportunities and develop interconnections. Although I think for some of my colleagues, they might say it creates more work, because I do have a tendency to call up April or Teresa or my manager and say, hey, I have this really great idea. I was in a meeting and we could do this. So it does seem to have a multiplying effect where we do often look to see all the different work that we can do, but that's a really great thing as well. So The second element of collective impact is shared measurements. And April certainly has talked about that around CK counts. It's our community indicators to measure our progress. So to support CK counts, the data consortium is being created, and this is a really great example of the influence of the cabinet, but then also the advantage of being in the CAO's office. The cabinet has certainly championed the need for the consortium, both with Gary and April being instrumental. But then when we wanted to reach out to the other municipalities, you can imagine if I picked up the phone to the other CAOs and said, you know, is this something you'd be interested in? They don't even know who I am. But it was so easy just to walk into our CAO's office and say, hey, Dawn, would you send out a letter, or would you call up all your CAO contacts and say, you know, can I talk to you about the data consortium? It just made it so much easier. The third element of collective impact is a common agenda. You heard about our successes related to healthy living and the start of our work in the education area related to the Canada Learning Bond. Yet I must say I found this area somewhat difficult, and it's partly because there's so many worthwhile topics that we can focus on. Having multiple topics does not always give us a strong common agenda. My role is to help encourage those conversations and how to address this type of thing so that the cabinet can have a continuous learning mentality. The fourth element of collective impact is to encourage mutually reinforcing activities. These activities flow out of the common agenda and are identified in the scorecard that I both develop and keep updated. The last element of collective impact is continuous communication. If I wanted to evaluate our performance on this, I think I would say it's hit and miss. We have both struggled, I really have struggled with this one from day one, really from the day the cabinet was formed. We do have a small website present. We issue news releases for lots of our recognitions. We have our strategy documents. We have our CK counts for external items. Yet it's a really delicate balance to know the type and quantity of information to provide to the leaders both in the meetings and in between. Continuous communication is a critical element both for the leaders to know when they are making a difference, but also to engage others. Last year I was chatting with a leader, and he said, Karen, I'm not sure we're making much difference. I don't see a lot of things being done. It was one of those heart-stopping moments, but you know, it was in a really good way. It produced a document called our 2014 Year in Review that's actually over there on the table. And it got me thinking, you know, when you bring the right people together who can move people, money, and things to create change, it can seem minor to them. This leader made a policy change in their school board that was the first in Ontario. I actually think April received a phone call from the ministry to say, how on earth did you make that happen? You know, another business leader we just learned made a decision to change all his external newsletters to size 18 font to support our age-friendly community initiative after he heard the presentation at the last meeting. To them, it's really easy. They have the authority and the ability to change policies in an instant. These are the successes that they hardly see as actions, actually, that we want to celebrate, but that probably happen quite often, but that we may not always know about. As I close, I really want to just focus on one more thing that I believe is the most important function of my job, to create an environment where non-committal conversations can occur, where leaders can feel comfortable to express their opinions and know that their views will be kept confidential and what they say will be heard and respected. My goal is not to find unity of opinion, but a shared interest and agreement for action while building relationship. At a conference last year that I attended, a speaker said, relationships are built at the speed of trust. It made me reflect. This is the heart of my job. People must not only trust each other, but they must trust the process. When we started the cabinet, some of the leaders had not even met each other, let alone worked with different sectors. Trust takes time to develop. The slogan for your symposium is Cultivating, Innovation, and Building Community. You are here in Chatham-Kent, a community that is all about growing and cultivating food for the world. Well, just like water grows the plants, I believe trust is what cultivates collaboration and builds community.
Thanks, Karen. Gary, we've chatted several times, and I've shared with you that my colleagues have told us that they are amazed that the work that we have done working with the LIN. So I'm sure there's a lot of people in here that would like to know why that relationship has been so successful in Chatham-Kent, and what recommendations do you have for other groups trying to engage with the LIN in their area?
So can I stand up?
You sure can.
Move aside. So I saw the 5-minute warning come up, so I'm going to be quick. And I'll tell you why. I'll talk to you about, let's call her Linda B. And I usually have a ribbon when I do this, so I hope you could see it. So Linda B was picked up at the local department store for shoplifting. She got into a bit of a scuffle and was brought to the emergency department. So I'm going to tie a knot. While at the emergency department, they realized they had to do an x-ray on her wrist because it was broken. They knew it was broken, but they wanted to see what else was in there. She had numerous fractures that were not healed properly. So let's tie another knot. While she was being triaged, the doctors asked about the bruises on her face. They didn't occur at the scuffle at the store. That's domestic violence. As they do their blood work, they realize that she happens to be an alcoholic. She had a high content of alcohol, and there were drugs in her system. You see, I'm running out of space here, right? She sits down. I can't tie anymore, but I want you to tie a knot in your mind every time this happens. She sits down with the social worker. They find out that she's unemployed. She's on housing assistance. She has 3 kids between 10 and 15 living at home. She has a part-time husband. So this isn't health care. This isn't a health care issue. This is our issue. This is your issue. You know people that are in there. I see you nodding your head. So where do you start to undo this? And you see what happens to our system? You see what happens to our healthcare system, our social service system? It just eats up all your capacity. This is a true story. I've got hundreds of them. We can't solve this at a health table. We have to solve it together. Some of these knots take decades to undo. You need wraparound care. And that's why, as a LIN, I think it's important for us to become involved at mobilization tables, we call them, or discovery tables, to come together to provide greater integrated service in the community. We hear about the top 1% of our healthcare system users represent 34% of the spend. The 5% is 66%. These are the people that are presenting in the emergency room with poor education, with social issues. So which knot do you undo first? And you need a team around the table to figure that out and to help that person through the life. So that's why this LIN is involved, and that's why this LIN will stay involved. So when you go back to your municipalities, get yourself a nice big thick pink ribbon and start tying knots in it about the clients that you deal with, and you realize, geez, I need justice at the table. I need EMS at the table. I need healthcare at the table. I need educators at the table. I need employment services at the table. Then you'll get the solutions. Thank you.
Thanks, Gary. Okay, I'm going to ask one more question of Steve, and then we'll wrap it up. So Union Gas has sponsored this conference, and as a business, you certainly are already engaged, but what recommendations do you have for others who want to engage their business leaders?
Let me just go off script just for a minute, because I'm going to come back to a discussion that Valerie had on the Canada Learning Bond. And I think this will demonstrate sort of the value of the cabinet in the discussion that we are having in preparation for this conference. I personally hadn't heard that much about the Canada Learning Bond, but at the same time, it just so happens that I had been in contact with the Director of Education for the Lambton-Kent District School Board about trying to put something in place where Union Gas could take some of our new employees, recent grads, whether they're professional engineers or accountants or in the trades, pipe fitter, all the things that we do as a utility, and actually get young graduates that are now working at the company in front of students to talk about what they did, how they did it, what opportunities are out there. And then I think if you combine that with some education around funding on the Canada Learning Bond, I think you can then start to give a real impression to our youth in terms of what is possible out there. You know, Valerie talked about the fact that we have, you know, a low percentage of post-secondary education. I think a lot of times it's because the kids just don't see a path, they don't see an opportunity in the community. So I think that's a great example where we can partner together from a business perspective and a social service perspective to bring those things together. So I think that, back to my earlier comment, I think that's really the value of the cabinet. And it's taken a while to get there in terms of finding those points of interconnection and find how we can better leverage and collaborate together to bring a lot more impact than we could individually and tie those things together. And I wanted to make one other comment in terms of just, I think one of the things that we still struggle with as a cabinet, or at least I do, back to one of my earlier comments, is there's so much need out there and there's so many programs and there's so many initiatives. And the question is, when we want to try to engage the broader community, you know, how do we do that? How do we do it how do we communicate what we're trying to do in a simple and a concise way? Because if we go out to the community, and I know you know this, if you go out with 30 or 40 initiatives and programs, I think the community just, they get confused or overwhelmed in terms of what are we really trying to do. So I think one of the things that we're still working on as a cabinet is how do we really tie that together under you know, 2 or 3 or 4 things at most that we can communicate into the community in terms of what we're trying to do, how we're trying to do it. So again, we can spread outside the cabinet and get the community knowledgeable and involved in terms of what we're trying to do. But it's very difficult, and I've learned on this cabinet, as I said, there's just so many things that are going on, and the question is, how do you really frame it up in a way that you can get the broader community that supports it and behind it, and again, get that greater leverage of resources to make an impact. So, sorry, April, I didn't answer your question, but as I was listening to the panel, I just thought those were a couple things, maybe examples that would help tie together for you in terms of, I think, some of the value that you can get out of a cabinet when you have a good cross-section of leaders within your community.
I actually think you did answer the question, Steve, by just speaking from the heart in terms of that business side of things. So in closing, before we see if you have any questions, up on the screen there is our Leaders Cabinet logo. And, you know, a lot of people do logos and they look nice and they look pretty, but as a group, we wanted to share with you how we came to choose this as our logo. The colors are very important. The light blue and green supports Chatham-Kent's community brand work, which we're very proud to be part of, and it's our small part of building that brand. We added a third color to represent the importance of working from a tri-sector integration perspective, of having our business leaders, our government leaders, our social and voluntary sector leaders all coming together. The circular motion represents collaboration and continuous improvement, just like the theme of, like your theme of innovation. The lines crossing represent system integration. It is a hub-type concept of spinning off things that are worthy of being recognized, celebrated, and endorsed, and can only be done through leadership. Lastly, the name, Chatham-Kent Community Leaders Cabinet. We really wanted it to be about community and not about any one leader. It had to be about the collective, and at times everyone would receive recognition, and at other times nobody would, because the focus needed to be on the community, and it can be amazing what happens when no one has to receive credit for the things that we've done. It's like Mayor Hope said in his introduction, we want to envision our community where we do work together to help everyone have a safe place to sleep and have enough food to eat. And as a member of the cabinet, I can say we still have lots of opportunities to pursue, but what I admire about this group, and especially the 4 members that have come today to share their thoughts, is that each person leads in their own unique way, which allows us to move forward, to build relationships, and to work together to find new and innovative ways to enhance the quality of life for people in Chatham-Kent. So thank you for listening, and I don't know if we have any time for a few questions. If anybody has any questions, that's up to our conference folks. But if anyone's got questions, the panel would certainly answer any that you have. Okay, fair enough then. Thank you.